All right, pharmacist interventions, part 24. I had a caregiver picking up a medication for a patient, and it flagged for CKD, chronic kidney disease. So the patient had CKD5. There are 5 stages of chronic kidney disease. Stage 5 is the last stage. This is renal failure or kidney failure. This patient was on dialysis, and the caregiver was picking up Crestor for the patient, rosuvastatin. Crestor is for hypercholesterolemia. It's a statin, and the dose was flagging for basically too high. So they're picking up only 20 milligrams, and the dose for patients with end-stage renal disease should be about 5 to 10 milligrams. So it wasn't too much of a difference, but I did counsel on signs of too high of levels, what that would present as. So I was like, is the patient experiencing any muscle pain, myalgia? And the caregiver was like, it's interesting that you ask that, because yeah, she's been having a lot of muscle pain, and that's why she's not here right now. She's waiting in the car. So I was like, oh, that's really interesting. So I recommended to follow up with the provider, and then maybe even do a CPK, or creatine phosphokinase. It's an enzyme that'll show up in labs in the blood if you have some muscle breakdown, which is what we worry about with statins, particularly the higher doses. I will say medications like pravastatin and Crestor out of the statins have lower risk of muscle breakdown and myalgia, but the risk is still existent in some patients. So this has to do with hydrophilicity or lipophilicity. Hydrophilic medications are going to reside in the plasma usually, and lipophilic medications are usually going to reside in the tissue. So dialysis dosing can get pretty complicated. There are a couple different types of dialysis: intermittent and continuous, or CRRT, continuous renal replacement therapy, and a lot of CRRTs exist. So with intermittent dialysis, there's either hemodialysis or peritoneal dialysis. Hemodialysis you'll usually do maybe 3 times a week. It'll be a 4-hour session. Peritoneal dialysis is a lot more complicated, and there are a couple different types. Peritoneal dialysis will literally use the peritoneal lining in the abdominal cavity to filter out toxins and waste products.